All right, Randy and I are looking forward to sitting down and talking with Sean Hopkins, who is a SWAT nurse on the front lines of everything COVID right now. Sean, we can't thank you enough for taking time to talk with us today. Randy and I were talking, and we thought that it was so important to talk to somebody who is on the front lines to give just a real feel of really what is going on inside the walls. And so really, I just want to kick off by saying, one, how are you, and how's your family, how's your team? And then if you can talk a little bit about, what you're experiencing right now.
Sure. I'm doing fine. Thank you for asking. It's busy. They're busy days. No, I'm not gonna lie, they're busy days. As a nurse, we're working 12-hour days. Our standard shift is 7A to 7P, so we're here for those days. We're working extra time. Most of us are picking up extra days as well. So you're working 4, 5, or even 6 12s a week. So those are tiring. They're fatiguing, without a doubt. But the need is there, and I think the people really appreciate us being around. My team is a specialized team. So SWAT, if I can kind of tell you what that's about, that might help a little bit. SWAT stands for Specialized Work in Transition. So our team is involved in all the rapid responses within the hospitals. So anybody that has trouble breathing, heart attacks, or needs specialized care with transportation or ICU care, then they call us to help out. Now with the COVID pandemic, those patients, there's a lot of them there. And the nurses on the floors require a lot of, or at least ask for a lot of assistance in helping manage those patients because it can deteriorate so quickly. So we get called a lot to do those kind of interventions and to help with those patients. So our phones are always ringing to kind of get that. And then there's the other duties that go along with it. So it keeps us busy. We enjoy it. We love our work. I think that's why we're so dedicated to the hours that we're spending at it. And, we like to think it makes it a very much important and supportive to the frontline nurses as well, because we can bring that extra critical care thinking to it. So, we're all ICU trained, and the nurses that get nervous about their patients, they care so much about their patients and they don't want to see them do poorly. They can call us to kind of help intervene and help with that along. And I think that supports them a lot more than we think it does. And I hope that it does. So we're good. We're doing well. We're coping okay with it.
I have an observation. The one thing I like about Sean, I detected, and correct me if I'm wrong, a Canadian accent.
Yeah.
All of our friends in Canada are so humble.
Wow. I am Canadian. I do. It's interesting because I do live in a border town. So I live in Windsor and communicate to Detroit to go to work. It's a border epidemic, right? I mean, it's all over. So the people on Canada are fighting the same battle and doing the same things. And I have a lot of friends on both sides of the borders that are doing the same things we're doing every day. So it's unifying in that sense. And the Canadian accent's a little hard to find, eh?
Right. Sean, let me ask you a question. We many of us, if not all, have seen the applause of people in New York as the doctors are changing shifts, and we're seeing that at hospitals all over the country, all over the world. You all on the front lines are really the faces of selflessness. I don't know if any of you, I can't speak to this, but I would imagine that no one thought when they were going to school that this is what they were going to necessarily maybe see. It's what we read about in the books or read about in the Bible, right? So, and so what is, define selflessness. I mean, I don't even know if you have to define it because you are doing it, but what is it like to be around so many selfless people, helping so many people while you all put yourself at risk?
That's a tough, I think part of it is, a lot of our nurses, a lot of the ones that I know, we know we're putting ourselves at risk, but we also know that it's part of our job. You know, we never thought, nobody thought that you'd be in a pandemic in a nursing school. I mean, I've been a nurse for coming up on 30 years. I mean, who would have thought that you'd be in the middle of a pandemic or a global emergency, something, when you became a nurse? You know, the old saying, like, be a nurse, they said. It'll be fun, they said, you know, and, you know, it's a good job, they said. And it is, it's very rewarding. But who would have thought you would have been in the middle of something like this? So I think the nurses that we work with, I think the mentality of nurses on the front lines and in the hospitals all over the world are of, you know, what do I need to do to make this person well, or to help here, knowing that I have to protect myself as well. And I guess that to be selfless is to put yourself first. Nobody wants to get sick. None of us want to get sick, but we also know, I think, that as long as we're doing what we should do to prevent ourselves from getting sick, and in this case, from spreading it around, you know, I think that might be the definition of selflessness. We're doing what we need to do and unifying as a team. Huge team mentality, like I've never seen before in nursing, between people literally just dropping what they have to do now to help out a team member in another room, and to making sure that, you know, we have the right equipment on board, the right safety equipment, the right PPE, those kind of things, and to be able to give it over to say, you know, here, take this, use this, you need it right now more than I do. And I think that the selflessness has evolved into that very much of a team effort and team model. So those heroes that people talk about are very much those people who are going into those rooms and doing the things that need to be done, knowing that at the end of the day, they're going to go home and have to shower and be clean and wash it all off and go do it again. And I think that's a unifying piece within all of us as far as nurses go. I don't know if that answers your question, but you know.
Yeah, to me, I mean, a quick observation, Sean, it's, and I'm sure it could be you and any team member of yours, but I'd imagine if all of you were sitting side by side, it would be very similar in terms of characteristics. It's the best way to describe it is inspiring heroism. That's really what it is. So my question to you, Sean, is,
Sure.
knowing you're on the front line and you don't know what the day is going to bring. You know, you have the altruistic side of Sean, and then you have the risk taker. How do you balance the two?
Oh, I think that the biggest balance is safety. I think there's the key word there is to be safe. So the risk taker in me wants to charge in the room and make sure that everything is okay. But the safety part in me, you know, the dad part in me, because I've had kids too, is to do it safely. And so when I come out of that room, I want to know that I can go home and be with my family. I want to know that I can go home or come out into the hallway and be able to speak to my team, and not infect them. So I think the biggest kind of dividing line is, how am I going to do this safely so that I can provide the best care for the person and best care for myself? And I think as long as we're doing that, and that's one of the paramount things within our things. I've gone into rooms and had, you know, nurses in there without a gown on and have asked them to leave. You can't be in here. You have to go out of the room because you don't have a gown on. And then when get out of the room, ask them, you need to go change your scrubs because you were in that room and you were compromised. So for the rest of the day, and then to go back and see that nurse had gone and changed the scrubs, you know, is satisfying because they're understanding what the risks are.
Do you find that people have taken it, in the beginning, I think it was very lightly, but now the seriousness of it is, you know, impacted everybody? Have you seen a palpable change in the way people view it, both on the front line and then among patients and families?
I think we as nurses have always kind of taken it seriously. I think we were very afraid of it at first, and I think we still are, but we gained a more of understanding. The more it's been compromised within our patient population, I think we've gained a better understanding of the transmission. And because of that, and because of the support of each other and talking about, how to prevent the spread and things like that, that we've become more comfortable with it. So it's not laissez-faire. It's just a respectful safety prerogative. So we're respectful of the virus and how potential it can be. Patients and families, I think I feel bad for families because they can't come see their loved ones, and that's hard. So, all hospitals are trying FaceTime things and talking to patients, and, we get them to record a video on their phone, because that phone is often an important link between families, and they call them every day. When they don't get a hold of them, one of the first things that go back to their family members is their belongings and their phone. So if they know that there's a video on that phone, and sometimes that can be the last thing that they say to patients or to families, and it means a lot to them. So I think they're taking it seriously that way when those kind of things hit home. But there's also the people that think that they're immune, and that this is not going to affect them, and I feel cautiously scared for those people, because I think that they're going to get the sickest, and when it hits them hard, they're really not going to understand why.
Let's talk about that for a second, Sean, because you're talking about preventing the spread. We all have, all three of us have children. Mine are 14 and 17, and just smart ways to be more conscious. I mean, I see people not social distancing, walking around my community. It's I find it very irresponsible. But what can we do to just what can you share that can just wake people up maybe a little bit when it comes to social distancing, or just being preventative?
Just being preventative. I mean, I think that the government and the way things have been portrayed, as a mandated thing for social distancing, trying to stay away from people, is a good thing, because it puts it in the forefront. But it's like anything. It's like somebody telling you, to do something, you're more hesitant, or a lot of people are more hesitant to do it because, well, I'm not going to do it just because I'm told. And so that impact of seeing somebody or knowing somebody that has gotten ill, and deathly ill maybe, and survived, or how sick they got, is probably some of the biggest impact. So those kids, you said yours are 14 and 17. Mine are 19, 22, and 24. And, a couple of, one is working from home, and the other two still have to go to work. And one of them actually works out in the community. So it didn't take until somebody got close that he asked me, should I be wearing a mask when I'm working? And for him, that was big, because he works out in the community, with garbage disposal. So he's on the back of a truck. He's not really touching or communicating with anybody, but he's in the community, and he was worried about, should I be wearing a mask? So I think that sometimes it takes that personal touch or that personal effect before it really hits home, unfortunately. And this virus is so contagious and can cause so much damage between people and families that they don't realize it until a friend of theirs or their friend's mom all of a sudden got it. And then all of a sudden it hits home. It's like, oh my God, I was there last week. Could I be sick? So the preventative measures then really hit home for washing my hands, wearing gloves at public places like gas stations and stuff. And no one ever thought of doing that. But here today, I went and got gas, and I put on rubber gloves, and I seen 3 other people filling up, and they all had rubber gloves on.
Yeah.
So, the message is there. It's a tough message to follow when it's a new normal that people want to try and follow, and it's striking them hard.
Do you think this new normal is going to be here for a significant period longer, or do you think it's just one day we're going to wake up and it's done?
This has changed my practice as a nurse. So I know I'm going to participate like this normal is going to be here for a while. So as a rapid responder, when I go to rooms or within the hospital community now to respond to a rapid, and when somebody needs my help, one of the first questions moving forward I'll have to ask will be, are they COVID positive? Because I know that going into that room without proper protection, I'm going to come out of that room and be a potential infection source. So my new normal now is, has the patient been tested for COVID positive if they reach certain criteria? And then I think, coming into hospitals, there's so many people with asthma and COPD and smokers and vaping and all those kind of things. There's so many things out there that can cause respiratory difficulties. I think that new normal will be, or could be, are they being tested for COVID before they get admitted? And then, that puts a big strain on resources, right? For emergency room staff, and because now they're already faced with the unknown of what they're coming in with. Now they have to be worried about, is this something that's potentially going to spread very quickly and just keep spreading every time somebody goes in the room? So I myself will probably operate that this new normal will be my new normal in practice for a long time. Whether that picks up with other people or institutions or organizations, I guess only time will tell. But I think for nurses on the front line, it'll be the new normal for a while. I need to know whether they're being tested or not, and should they be tested?
Yeah.
Moving forward. Yeah.
It sounds like we'll be walking around with masks and gloves for quite some time.
I think we'll probably have masks on, to prevent transmission, because it seems to be that way. I know I'll wear a mask in public now, for my own self, but of course I work as a nurse, so it's not for me, it's for you.
Yeah.
Right?
Well said.
There's so much, Sean, there's so much stress. People are going through so much stress right now. And this came on with just just in a shocking way. You and all of your colleagues are on the front lines dealing with tremendous stress. And I think people in general are trying to figure out, and I'd love to know how you're doing this, just getting back to center, right? Getting back to center to know, hey, I've got to even talking to you it's hard to believe that, I shouldn't say it's hard to believe, but you're so grounded and you just seem to be so, your mindset just seems to be so in sync and during this crisis. But how do you get back to center? Because I think it will, kind of give people a reminder on how maybe they can get back to center so they're not living in panic.
Yeah. Well, myself, the big part of me getting centered is my family. I'm not gonna lie. I keep in touch with my kids as much as I can, even though they're grown. In touch with my dad. I can't see those. I don't go to them and I don't see them as much, but I try and keep in touch with them. But, I live with my wife and she is probably the biggest part of what keeps me centered. When I come home and I'm exhausted, she knows that I'm exhausted. She'll listen to what I have to say. There's been days where, it's exhausting to the point where you're almost brought to tears. And, that support at home where, there's no pressure to talk, but there's also no pressure to not talk and to do anything is probably the biggest, within that. And then, myself, I try and stay as active as I can. I do go for walks, and I love being in my backyard or playing with the dog, or I fiddle on the guitar a little bit here as a hobby, and staying physically active is probably one of the biggest things. But to keep it grounded and centered within that, I think is the team that I work with is probably one of the biggest parts, because when I come to work and it is such a high stressful day, the team all is experiencing it at the same time. And so we lean on each other, and work almost like a well-oiled machine. So one person is doing something because that's what I would have been doing at the next step. So things run very smoothly. And then we work through those processes that make it run smoothly. So the stress level comes down because we're so supportive of each other. And on very busy days, that's what really, really counts the most. I never feel like I'm alone. My team, my wife, my family, I never feel like I'm alone. And I think that's probably some of the biggest things, because if you feel like you're alone, then it's hard to get up the next day and come back and do it again.
Yeah.
So I don't know if that makes sense, but
Yeah.
that's how I feel grounded, because I never ever feel like I'm alone.
Yeah. Makes perfect sense to me.
You avoid the fear. So, fear can obviously described in many different ways, but you're the type of person, Sean, based on your reflections, as you're a face everything and rise type of person, and having the right team there, the well-oiled machine you describe, and having this grounded and centeredness is going to make all the difference in the world.
Yeah. I hope so, because they keep telling us that this is not a sprint, this is a marathon race. And this marathon race keeps turning into, well, things are in for a couple more weeks, and it's like that marathon where you hit that wall and you can't go another minute, and you just can't put another step in front of the other. And I never want to get to that wall. We never want to reach that wall, because if we do, as a team and as a healthcare team, then there's a lot of people that are going to not benefit from it. And that's hard. That's hard to comprehend, because we're needed so much. So, yeah.
Sean, in my last question is this, and then Randy, I'll let you ask. But what's one piece of advice that you would give someone listening right now?
One piece of advice, I would say, don't panic for every day. There's something new going to come around from this every day. And I think, like you said, Randy, don't give in to some fear. And I think you can sit around all day and get in your own head and think up what's going on next, and dream about, what the theories are, and why aren't they doing this, and why aren't they doing that? And then you can work yourself into a depressive panic, or to a panic. And if you don't reach into that dark place, if you don't get there, and you have the support of the people around you to just take a breath, practice your social distancing, practice those things that keep you safe, and take a breath and relax, I think that it'll work out. And for anybody that is feeling sick or is worried about whether they are sick, then that's when you would seek the support that you need. And so I think just don't panic. Just don't panic. It's here. We knew it was coming. The panic phase, I think, is over now. It's the maintenance phase, and there's more states hit harder than others. I can't imagine the devastation going on in New York, in the major cities. Some numbers are still going up, and it can cause people to panic. But if you stay into your isolation, if you stay into your grounding, where you can keep grounded and practice those safe things, then I think you'll be okay. It'll be okay.
Yeah.
I don't know,
Good.
Does that? I don't know if that answers it or not.
It did. Thank you for that. That was beautiful.
Yeah.
Randy?
My last question, Sean, if you were giving advice to your old self, the younger Sean, even though you look much younger than
the masks are leaving some new scars in there today.
What advice would you give the younger Sean?
To a younger Sean?
Mhm.
prepare yourself. Be prepared.
Yeah.
Just be prepared. I would have never imagined nurse when I first started, you know, almost 30 years ago, that I would be faced with life and death every day. And, you know, when I became a nurse 30 years ago, and I started just in intensive care and emergency care and trauma care and things like that, there was that adrenaline junkie nurse, you know, who loved kind of being in those situations, because that's what I felt that what I was called to do, and or what nursing was for me at that time. And if I could give myself that advice now, it would be, that's coming, my friend. It's coming, and you will get every opportunity to practice those things. So don't rush into it, and take your time. Just take your time and learn what you need to learn, because the time will come where you're going to need to learn it on the fly, and learning it on the fly is often never a good thing. If you can control it that way, then that would be best. And I think that would probably be my advice to me 25 years ago or 30 years ago.
It's good. It's good. Well, Sean, I can't thank you enough. I think I speak on behalf of Randy and I. We're so grateful for everything that you're doing, the front lines. You are doing the most soulful work that anybody could do. You are doing God's work, and we appreciate you and all of the people on the front lines, all of your colleagues, and everywhere around the world. And thank you so much for what you're doing and keeping everybody safe to the best that you can. And continue to stay safe. And we appreciate you, you know, so much. And thank you. Randy, any thoughts?
Thank you. I agree. I echo the same sentiment. You guys are truly doing God's work. You make it look easy. You know, it's it's inspiring. It's heroic. And I don't think
heroic.
do what you do. So thank you.
Yeah.
Thank you.
You're welcome. I think the nurses all over the place are, you know, not just from my team, but we're all feeling the same way. We're all trying to do the best we can. And, you know, that goes to all the hardest hit counties and cities, and all the way to the hardest hit countries. And like I said before, I think it's a unifying experience for nurses that have living in this time, that we're going to come out of this on the other end and go, man, you remember the pandemic of 2020? And a nurse in Italy is going to say, I sure do. And the nurse in New York is going to pipe up and go, me too. I remember the exact same thing, because we were all doing the same thing. Yeah. And I think that's something great for healthcare and for nursing, and for the public to know that we're here for you. We're really trying hard, and we want everyone to be safe.
That's great. Are you feeling all the love from everyone? Are you feeling all the love and the prayer?
Oh yeah.
Yeah.
There's messages from people and families, and you know, there's chalk things on the stairs as you come in, and there's signs out front, and there's all kinds of stuff around, and people, I think, are very grateful, because I'm not sure that they would know what to do in this situation when they get sick. So I think they're thankful for that people are there, that we're trying our best to figure out what to do for you, and that when you get sick, and God forbid you ever do, that when you get there, we're ready for you, and we'll be there for you, and we'll know what to do for you. And I hope that in some way that eases the public's mind, because, you know, it's been a rush of an experience, let me tell you.
Well, thank you again, Sean. Thank you again.
You're welcome.
You and your family and all your colleagues will continue to be in our thoughts and our prayers. And thank you for everything you do.
You're welcome.
Thank you. Stay well.
Thank you, Rand. You too. You guys take care of yourselves and be safe. Be safe.